Hi, I'm Meg Bona, campaign organizer with Consumer Reports Health Cover America Tour. The Cover America Tour hosted house parties at both the Democratic and Republican national conventions in Minneapolis and Denver. We wanted to hear what Democrats and Republicans had to say about the current healthcare system. Healthcare is a very personal thing that people deal with, and so we thought, let's go to their homes, let's go to their communities, let's film them in where they live and see how these healthcare choices, decisions that they're having to make are really affecting their daily lives.
Got MRSA, got a big staph infection, had 8 surgeries over about a year and a half's time.
And I'm on the phone, not exaggerating, at least monthly, understanding what deductible I have to hit before they'll pay anything.
I have, run into very big complications in insurance, and we have a good health plan. We've never really had major issues, but we do have some small ones, and I'd be scared to see what someone who didn't have the resources and the time that I have would have to go through to just get, something simple.
The biggest healthcare issue is the fact that there is not healthcare access for everybody. Lack of access to preventative care that then leads to larger problems.
One of the things about the Twin Cities is we have excellent health care. We have really good providers. I think the biggest problem is access.
If a cancer treatment has not been FDA approved, you can't always get your insurance company to pay for it, and a lot of these cycles of these drugs cost $10,000 to $20,000 per cycle. So it can get cost prohibitive very fast.
It's the 47 million people who are uninsured in our country it's a tragedy. I think in America that shouldn't happen. Some of those people are in my family.
Up until a couple years ago, from the time I graduated college until I was lucky enough to get a job with benefits, I went without insurance and, like a lot of people, rolled the dice.
But once people are on Medicare, it certainly is not a panacea. Medicare has high out-of-pockets for hospital. Even Medicare Part B, which has a premium, also has deductibles and coinsurance and lots of rules as to what providers you can use.
There has to be a big paradigm shift. There's nothing that Western medicine does that keeps people healthy. There is nothing.
We need to come up with a whole new system that's based on prevention, self-responsibility, that sort of thing.
You should be able to be healed of whatever problems you have, regardless of who you are, regardless of how much money you make.
And trying to come up with a system that deals with the variability of living things, of human beings, is a hard thing. It's really hard, and not to oversimplify that. But we don't need to make the administration so complex.
Even just hearing the variety of issues that have been brought up in this meeting, it's like there are so many issues across the country that different issues that different kinds of people face, and how can you create a comprehensive system that will account for all of those needs.
The house parties gave us a real opportunity to meet with local activists that we hadn't had a chance yet to come face to face with, and we hope that this is the first step as they join us on the journey for healthcare reform.